My name is Wesley Eplin. I serve as the Director of Health Equity at Health and Medicine Policy Research Group. My pronouns are he, him, and his. Welcome to Deny the Permit, Public Health, Democracy, and Environmental Racism. This event is hosted by the Collaborative for Health Equity Cook County and Health and Medicine Policy Research Group. Before we move on, I want to give a land acknowledgement. We recognize and acknowledge that we live and work in the land of the Peoria, Miami, Kickapoo, and Potawatomi nations. These lands were the traditional territory of these native nations prior to their forced removal. They continue to carry the stories of their struggles for survival and identity today on these and other lands. As organizations located in Chicago within the state of Illinois, we are obligated to hold these histories and contemporary struggles in our mind today as we talk about community, belonging, and health. I also want to make a note of thanks to the Southeast Side community public health leaders who've been advocating on the issue of General Iron and denying the permit. So we've seen long-term leadership here, multiple generations of advocacy for environmental justice, and major dedication to and sacrifice for this cause and this issue in particular, and really have put this issue on the map, and we wouldn't be here today without that leadership. So sincere thanks for that leadership and real sacrifice that it's taken to bring this conversation about and to push for progress for environmental justice. A little bit about Health and Medicine Policy Research Group. Health and Medicine's mission is to promote the health of all Illinoisans by advancing health equity. And you can follow us on social media and learn more about our work at the links shown on the screen. A bit about the Collaborative for Health Equity Cook County. The mission of CHE Cook County is to build relationships and alliances with other sectors and community organizations in order to change the maldistribution of money, power, and resources that produces the gross injustices and inequities we see in our communities today. And again, you can follow us on social media to learn more about our work and to engage with us. I also want to flag that this is National Public Health Week, and this is a prime opportunity for the Chicago Department of Public Health and its leadership, Dr. Allison Arwady, to lead on environmental justice and meet their responsibilities and commitments, in part by denying the permit, right? So, wanted to flag that it's National Public Health Week, and this is a prime opportunity for us to be able to come around and support public health collectively in Chicago and certainly beyond Chicago. And what we're here to talk about today is environmental justice, right? So this idea that Chicago must stop structuring health risk in a racist way, which has been the pattern for a very, very long time. This is not just a permitting issue, but environmental racism literally makes people sick and it kills people and it leads to early death. And so that is what we're here to talk about in terms of denying the permit. It is about people's lives. So next, I'd like to introduce our forum moderator. So our moderator tonight is Lillian Jimenez. Lillian is an attorney specializing in policy advocacy, community building, and government administration. Lillian has extensive experience working in nonprofit and government settings, promoting the rights of low-income communities of color, most recently as the Associate Director of the Illinois Department of Human Services Office of Welcoming Centers, and before that as Chief of Staff for Jesus Chuy Garcia. Lillian has developed and implemented policies in immigration, worker rights, health equity, and is a board member of the Collaborative for Health Equity Cook County. She also grew up in the southeast side of Chicago and has family that lives within a mile of the proposed General Iron site. So with that, I'm going to turn it over to Lillian.
Hello, everyone. Thank you so much for joining us, and thank you for that introduction, Wesley. from Health and Medicine. So we are here to hear from a really great panel. I was really excited when I was first approached about this panel because there's so many important things to discuss around, our theme today of public health, democracy, and environmental racism. And those themes really touch so much of my work and so much of the city of Chicago and the community that has really raised me to be a public health advocate and a public health activist. And the struggle specifically around the struggle to stop General Iron or the RGM facility from relocating to the southeast side is also, I believe, one of the most important, if not the most important struggles around public health, environmental justice, and racial justice in Chicago and surrounding areas. There's a number of struggles, and the interesting thing is that you'll hear from one of our panelists is how this struggle has really reached across to other communities and has reached out to other sectors, such as the public health sector and the health sector itself. And that's really the intersection of a lot of my work. I was raised in the southeast side of Chicago, growing up a few blocks from the lakefront in Chicago. But to be honest, I did not know that I lived a few blocks from the lakefront until I was in my maybe early 20s or teenage years or early 20s, because the way that the steel mills, when they left the area, left a big brown field environmental just fences up along the lakefront where you couldn't even see the lakefront for miles and miles and miles. So I didn't even realize how close I was to the lakefront. And I still kind of, think upon like the loss, of the community of that beautiful lakefront and of the knowledge of what our history is there. And we weren't taught a lot of our history of the steel mills, but it was really what brought my family, my dad from Puerto Rico, my grandfather from Puerto Rico, who brought my father as a young boy to the southeast side of Chicago. And so that community is really a community that had many, many immigrants for many, many years, but for the last 50 years or so has really been a Black and Latino neighborhood and community. And the environmental situation there has, of course, the industrial corridors, this being one of them, has really grown, and there's been more and more industrial polluters in the area, which you'll hear more about from people who've been on the ground and on this fight. But I wanted to just mention my personal connection and my family still living in the area, my niece and nephew living just blocks away from the proposed site. And knowing that my nephew, Diego, would have to go to school and walk by this industrial polluter is one of the things that motivates me. Of course, it motivates me regardless of if I had a family connection, but I wanted to share with folks that it does really, how it really impacts my family and my community. And so I wanted to, I'm going to introduce our panelists right now, but I just wanted to say, this is just an example of environmental racism at the highest levels of Chicago government. And it's also an example, unfortunately, as we've seen over the last few years, about how gentrification, moneyed interest, industrial polluters can collude and conspire to promote their interests and get the acquiescence of government officials. But finally, it's also an example of how communities learn and know how to fight back. It's not a new thing that communities, and you'll hear from Dr. Murray about this, but what's been done around this fight is really, really important. And it's built upon many, many years of the community fighting other industrial polluters around manganese, pet coke, and I invite one of my panelists, Olga Bautista, to talk a little bit more about that. So you can learn about, these things, those struggles, as you'll learn from Dr. Murray, don't happen overnight. The fight doesn't happen overnight, but building upon our history is what is really important and really inspiring to me. So as Wesley mentioned, also, the interesting here is kind of the multi-generational collaboration of organizations who have been fighting the struggle for decades, as well as younger people who are really rising up. And this summer, it was, again, very inspiring to see so many young people around the Black Lives Matter, but also connecting the dots around environmental racism in the Southeast Side community, and folks coming from different communities in Chicago, and folks from the Southeast Side going to other communities like Little Village and Humboldt Park to kind of to share and to build community. So finally, just wanted to mention, again, the public health role, right? We have so many public health professionals here joining us, leaders, students, workers, people who just care about public health, who came into it as I did, from kind of sideways, but really who love and understand public health as something that guides us for justice. And being part of the Collaborative for Health Equity, and being, I learned, I've learned so much, but I just am so inspired again by Collaborative for Health Equity and Health and Medicine Policy Research Group, who did take the lead to gather folks who signed over 500 public health and healthcare workers, students, and community activists, and 70 national and local organizations signed a letter to demand the city of Chicago take decisive action to deny the permit to relocate General Iron. And it was, again, I was shocked to see when we got a response from the health commissioner, Dr. Attaway, because of the power of folks like you who are here, and folks like our panelists here also, who Chloe Gurin-Sands, who you'll hear from. So, and the power of our words and the power of our collective voice as public health leaders and public health, the people who care about public health, is so vital in this movement and so important. And so I welcome you to listen, to hear, to learn from the struggles and with the panelists, and to help us to take action, which we will circle back at the end to talk a little bit more about how to take action. So I'd like to introduce our first speaker, Dr. Linda Ray Murray, who I've learned so much from. She spent her career serving the medically underserved and is a specialist in occupational and environmental health. She served as a member of the Board of Scientific Counselors for the Agency for Toxic Substances and Disease Registry, and the Board of Scientific Counselors for the National Institute of Occupational Safety and Health. During 2011, Director Murray served as the president of the American Public Health Association. And in December of 2018, Dr. Murray stopped seeing patients, ending over 40 years of clinical practice. Today, she's an adjunct assistant professor at the University of Illinois School of Public Health. She serves on many local and national boards, including the Chicago-based Health and Medicine Policy Research Group, and chairs the board for the National Collaborative for Health Equity. Dr. Murray is devoting the rest of her career to being an enthusiastic, full-time troublemaker. She has been a voice for social justice and health as a basic human right for over 50 years. So Dr. Linda Ray Murray will help us out here. Thank you.
Thank you so much, Lillian. I'm glad to be here tonight with folks from Chicago. And I want to start off by giving homage to one of the leaders, now deceased, really considered one of the mothers of the National Environmental Justice Movement, Hazel Johnson. Hazel Johnson is a resident of Altgeld Gardens and really a leader fighting pollution, toxic pollution around the gardens. She was a community activist. She never gave up fussing and yelling and screaming and fighting the Chicago waste industry. She spent 30 years of her life in that community fighting against these polluters. She really has had a national impact in the environmental justice movement. You can see that the Gardens has named a part of the street, Hazel Johnson Environmental Justice Way. And you can see her there with former President Clinton signing his executive order on environmental justice. Hazel is one of the people that helped organize in 1991 the first National Peoples of Color Environmental Leadership Summit. And we should be clear that the environmental movement didn't begin with white people in the 70s. It really goes back to the struggle of the indigenous people of this hemisphere, and certainly in North America, to save and preserve and treat the land as sacred. It goes back to the fight around slavery and the fight against segregation, and it grows directly out of the 1960s civil rights movement. And so in local leaders like Miss Johnson and leaders in Texas and Louisiana and New York, all over the country, especially Black, Brown, and Indigenous leaders, really came together in a conference in 1991 with over 1,000 participants, where these issues were debated and discussed. And really, and I invite you to Google this, the Principles of Environmental Justice was written and endorsed by this national conference of people of color in our country. We don't have time to review all the principles, but it is a statement of principles that seats us clearly in the history of our nation and talks about 500 years of colonialism and oppression being the fundamental underlying problems with environmental injustice and environmental racism. And it lays out the principles by which discussions like the one we're trying to have in Chicago on the relocation of General Iron ought to go on. And it affirms that all of us have an equal partnership at the table when we talk about environmental justice. Just because you live in Lincoln Park doesn't mean you get more of a say than if you live in the southeast side of Chicago. It demands that we take into account the health of the planet, especially when we are faced with the really existential threat of climate change going on right underneath us. It argues that part and parcel of environmental justice has to be the right to political, economic, cultural, and environmental self-determination of all people of the planet. It calls for us to be equal partners with the government in terms of needs assessment and how we really regulate these issues. It suggests, in fact, it argues that a violation of the principles of environmental justice, a policy that in fact endorses and reifies environmental racism, is a violation of basic human rights in the UN Charter. And so we're talking about the basic ability of us to survive on the planet as human beings. So why are we here? Why are we having this discussion? I'm not a lawyer. I'm an environmental and occupational specialist as a physician. Public health is what I've done. So let me be clear, because I don't want us to be confused about this. We have a regulatory process which varies by state and city. We have one here where the state of Illinois and the city of Chicago play a governmental role in deciding what kinds of industry gets cited where. But we should be clear, these regulations don't make sense. So one of the basic problems we have here is the regulations themselves are bad. What does that mean in plain English? What that means is if you kill 1 million people, that's probably against the regulations. But if you kill a couple of 100,000, who cares? In other words, the regulations we've written to restrict organizations and industries like this are not adequate. We act as though toxins have some rights. Toxins don't have rights. Chemicals are not innocent until proven guilty, but that's the way the regulations are written. We should assume that if you're dealing with a dirty industry, that the stuff is bad for us. That should be the first assumption. Not that, oh, General Iron is innocent until proven guilty. We shouldn't confuse human rights with what chemicals do and try to do. There is no inherent right, there ought not to be, an inherent right to make a profit. So it's not as though we need to say General Iron has a right to make a profit, and as long as they don't kill too many residents of the southeast side, who cares? Again, that's a backwards way of thinking. I don't think you have to be an engineer. I don't think you have to be a lawyer. I don't think you have to be a physician or a public health expert to actually decide whether it makes sense to place this polluting industry in the middle of a residential community. Do I think it belonged on the north side? No, but they didn't ask me. I know one thing, it clearly doesn't belong where human beings are around. And the fact that this plant is being cited in what is already a toxic donut, where we already have centuries of toxins built up. Oakdale Gardens itself was built on toxic landfill from the Pullman Train Company factory. So when it opened for Black people, it was built on a dump. And we don't need to make it worse by adding more polluting industries in that area. So we sort of box ourselves into pretending that we have data that does not prove that this industry is dangerous. What I would argue is any normal person with eyes should be able to see that this is a polluting industry. What it puts out in the air and water is not good for human beings and other living things. And what we need to be asking ourselves is if this industry ought to exist, and it certainly should not exist around people. So I'm glad to be here tonight. I look forward to hearing from our other panelists, because we have to stand together and deny this permit. Thank you.
Thank you. Thank you. So I wanted to, I mean, it just brings up so many questions, and I think a lot of us have a lot of questions for Dr. Murray and want to interact with that, with her comments there. But before we get to that, we'll get to that in a few minutes. But before we get to that, I wanted to introduce our next speaker, Chloe Guerin-Sands. Chloe is a manager of health equity and planning at the Metropolitan Planning Council, where she focuses on using planning and policy to improve community health outcomes. Chloe also serves as a co-chair of the Partnership for Healthy Chicago, a stakeholder body that assists with the development and implementation of Healthy Chicago 2025. I had the pleasure of meeting Chloe in preparation for this panel, and I'm already very impressed with Chloe and just inspired by her work. So Chloe, if you want to unmute yourself and turn your camera on, you can join us.
Thank you. And I am also going to go ahead and share my screen. So thank you first to Dr. Murray for that great introduction, and to the Health and Medicine and Shea Cook County team for inviting me. So what my goal is tonight is to give you all just a picture of what some of the public health commitments are that the city has made, that we need to be holding ourselves accountable to. And then some of the processes, planning processes that are underway that are an opportunity for us to really be pushing some of the messages that we're talking about tonight. So the first plan that I'm going to talk about is Healthy Chicago 2025. For some context for those that might have seen the plan but aren't sure where it came from, Healthy Chicago 2025 is Chicago's community health improvement plan. So the Department of Public Health, as an accredited local public health department, is required every 5 years to do an assessment of the community, in this case being the city of Chicago, how we're doing on metrics, what our community needs are, and then to put together a plan for addressing those needs. So for Healthy Chicago 2025, the goal that and framework that was stated for this is decreasing the life expectancy gap that we see in Chicago between our white and folks of color residents. So this graphic is from the report, and it shows that between 2012 and 2017, so keep in mind this is pre-COVID that we're seeing this, for the white population, the life expectancy stayed relatively the same throughout that time period, but we saw a decrease for Asian, Latinx, and Black residents of Chicago in terms of life expectancy. And so you can see there between white and Black Chicagoans that there's a nearly 9-year life expectancy gap on average. And then over on the right side of the screen, showing what our epidemiologists have figured out are the contributing factors to those. So chronic disease really is a huge portion of that, which is coming from the types of things that we see in our neighborhoods: pollution, lack of access to basic needs and care, all of the things that we're seeing exacerbated the situation like with COVID-19, and what people are really understanding are the basic essentials for living a healthy life. So Healthy Chicago 2025, in addition to again, taking that assessment of how we're doing as a city, we put together some priority areas for what we want to focus on. And so I'm going to share with you what the strategy, the commitments and strategies are that this plan lays out for the environment and the neighborhood and planning development areas. So for the environment, and I think this is really important to look at. So the populations that we've called out as experiencing the most inequities in this case are, of course, communities disproportionately burdened by pollution already. So to Dr. Murray's point, we know which communities those are already, the ones that we have already identified as being on the receiving end of all of these, intentional or not bad planning decisions and bad placement. So the plan, these are the commitments that, the city is making and the local public health system is all making. Refining the air quality and health index of the city and pursuing new data sources with community input. Forming an environmental equity working group to advise the city on environmental decisions. Assessing the cumulative impact of pollution at the local level, and enhancing policies related to our zoning, environmental regulation, enforcement, and community participation. And then I think it's really important to point out here what the measures are, what we say that how we are going to measure, whether we're meeting equity in terms of the environment, reducing exposures to pollution, and increasing the buffer between residential and industrial uses. And then our ideal state is that within one generation, Chicagoans will all have clean air and be protected from harmful pollutants. So taking that in the context of, decisions that we're making about industries, new industries or existing industries that are relocating, are we really thinking about this in the context of what the impacts one generation out will be right now if we're making a decision to continue to allow, certain industries. Lillian, I see you popped up. Is there
Yeah,
issue?
we're running out of time.
Oh, okay. I will hurry up. So neighborhood planning and development, all I wanted to note here is that we basically are saying that communities will be included in planning processes and investments will be made in partnership with communities using health and racial equity frameworks for those. The air quality report that the city put out, we just again wanted to point out the commitments that the city has publicly made to make changes to the way that we do business rules, and enforcement and inspection. So we want to hold ourselves and the city accountable to getting started on these processes instead of just saying we can't deny the permit because the rules don't currently allow us to. Well, we've said that we want to revisit those rules. Let's get started on that process. And then just noting that the industrial corridor process is happening, that this process is updating the industrial corridors throughout the city. So here are all 26 of the industrial corridors. And as zoning is changing in certain corridors, that puts pressure on businesses if they want to stay in the city to relocate to different areas of the city. And this is, a stated, not necessarily a goal, but, the city understands that, like, if we want to keep people in the city, we're going to have to help them relocate. And so again, just using the data that we have available to us to help us make the best decisions about where these things should relocate to if we want to keep them in the city and what the long-term impacts of that will be. And you will hear more about this effort on the screen from Olga. Thank you.
Thank you. There's that data, you know, if anybody else is geeking out with me, that's some just great, wonderful data and charts that were just shared. And so many questions about like how the city of Chicago is living up to its promises and its commitments. And questions about, you know, when partners are brought on, you know, how partners are, how partners feel about the fact that, you know, these commitments don't seem to be being met. So I want to introduce next Olga Bautista, you know, leave you wanting more there from Chloe as well, and introduce Olga Bautista, who is actually a lifelong friend of mine. We grew up both near each other in the Southeast side, and our paths kept crossing as we did environmental justice, racial justice work, and all kinds of good stuff. And I'm really proud of the work Olga has done in leading a lot of the environmental justice work over the last many years. And also Olga bridging the gap of generations before her and also bringing forward new generations, as she is a mentor for young folks in the Rebel Bells. She is representing today, wears many hats, but representing the Southeast Side Coalition to Ban Pet Coke. She has deep roots in environmental justice and a wealth of experience as an environmental advocate. And she has dedicated her professional career to improving the quality of life in her community on Chicago's Southeast Side. In her work, Olga elevates and champions equitable and land use decisions and is a board member of the Southeast Environmental Task Force and a mentor to the youth as an organization called Rebel Bells. So Olga, if you don't mind unmuting yourself, putting on your video. We'd love to hear from you. If you can, as much as possible, so much work that has gone on in the last couple of years, but if you can share with us around General Iron.
Thank you so much, Lily, and also to the organizers today. I'm really happy to be here with you all tonight as we're still like in the middle of this, I think one of the most important environmental justice campaigns that are happening in the United States right now. And we've been getting a lot of support, and I want to show, just share a little bit of a background of like what's going on with this plan to relocate General Iron, a metal shredder, from the Lincoln Park community to the Southeast side of Chicago, but also talk a little bit about just the history down here and some of the goals that the community has for our own community. So I'm going to go ahead and share my screen. How's that look? You guys can see that?
Looks good, I can see it.
Okay, good. So I'm just gonna start with the fact that there was a hunger strike to try to stop the last permit from being issued to General Iron, because we have never done anything like this on the Southeast side when it came to environmental justice issues, at least not since I've been involved. But we had gone to every public hearing. We had organized during the middle of a global pandemic when our neighborhood was getting hit really hard with job loss and people being sick. And we still managed to get hundreds of people to participate in the IEPA's permit hearing, the city of Chicago's hearings around General Iron, and all of the voices. There were people who were supporting the company's plans, but overwhelmingly it is a plan that has been rejected by the people who live in these communities. And right before the holidays, we got to the point where there was no more hearings or opportunities for people to really weigh in, and people in the community like Oscar Sanchez in the top, Yesenia Chavez, Brianna Bertacci, and Charles Stark, who is a teacher at George Washington High School, made a decision that because it was difficult to do direct actions and civil acts of disobedience and things that activists usually do in situations like this, that we would start a hunger strike. And we had 5 people who were on the hunger strike for 20 to 30 days, 3 who were 15 to 18 days, and 5 people who were on the hunger strike between 6 and 11 days. And it was really a turning point for this campaign because it got a lot of attention from international media outlets, from organizations from across the region, across the country. Support was coming in the form of donations to the hunger strikers, and also many green organizations, and we call them the big greens, like Sierra Club, the Nature Conservancy, and other groups wrote op-eds to the newspapers. We had a lot of blog posts about this with organizations who really, this is not like part of their DNA, like doing, like supporting direct actions and these kind of efforts, have been moved to weigh in and to also weigh in with the mayor and with the governor regarding this plan. So while, the mayor didn't meet with the hunger strikers, it's still, or Dr. Arwady, still many people did come out to support and also to keep a light shining on this issue, including the organizations that are putting this event tonight together for us. So what do we know about General Iron? It's going to be right across the street from George Washington High School, George Washington Elementary, and Rowan Park, which is a park that is heavily utilized by the community. There's soccer, softball, baseball practice and games that happen there. It's used year round. There's an ice skating ring. It's the go-to spot for many families to walk their dogs all year round. And this is the site where they're planning to relocate General Iron that's going to produce 16 tons of toxic PM10 yearly. So this is on top of the emissions that are coming from companies all up and down the Calumet River already. And the amount of trucks that are going to be needed to move the material in and out is also going to be a huge issue. So Lincoln Park residents did not want this in their community. They had complained for many years. So, the mantra has been, if it's not good enough for the people of Lincoln Park, then it's not good enough here. This is a picture that a friend of mine actually just a couple weeks ago took while he was flying over. This is Antonio Lopez from the Chicago Frontline Funding Initiative, who was traveling and snapped this picture. It actually looks like so small, like our neighborhood, like right in the middle, but you could see that there's it's an international port. The river, this is Lake Michigan. Can you guys see my mouse when I move it around on the screen?
Yes, we can.
Oh, okay. This is Calumet Park. This is Lake Michigan here. And this is right, it's not in the picture, but the mouth of the river is just right outside of this, the view right here. And this is the Skyway Bridge. And all along here are different industries, different companies, all the way back here. The ships that come through here are probably like the size of a city block. They're enormous ships that come through our river, billions of dollars in commodities and raw material pass through our neighborhood on a weekly basis. And you could see how close homes are to the river. And most of the activity that's along this river is like bulk storage. So like piles of material that's going to be used to make other things. Since the steel mills closed, the land is still zoned to handle pretty like heavy duty industry. And So the steel mills are gone, the jobs are gone, but the land along the banks of the Calumet River are still very much active. It is very much a working river. And it's also has been causing a lot of harm to the community. Oh, and I just wrote, that we this whole region, it's really hard for us to say like this is an issue that's just happening in Chicago, because so many of our families live like just outside of this neighborhood, like in the south suburbs, but also this is like the Indiana side is so close. So just so you have an idea, like this is happening right outside of the Chicago area. This is in East Chicago, Indiana. So there's like this whole region, even though there's borders that say that this is separate, like we do believe that we need to have reforms at every level of government to be able to protect the people who live in this region. The groups, so I think Chloe had mentioned that, this is not the first company that has been relocated to this area. This is actually the third that's coming directly from the North Branch of the Chicago River in the Lincoln Park community. So we have a pattern. We're seeing that the city is actively participating in cleaning up one part of the city and further, continuing the practice of dumping on the southeast side, because why not, right? The zoning is right. The people there are maybe immigrant, maybe they don't speak English, maybe are in a situation where they actually can't fight back. Whatever the reason is, like that the city is doing this kind of participating in these kind of actions, it's causing a huge problem that is not being felt in other parts of the city, right? So this disparity is the crux of the problem, is that it is improving one area and further contaminating an area that is already overburdened. So because this is the third company that has been relocated from this, the north side, there's 3 neighborhood groups that have filed civil rights complaints to HUD, basically saying, that you're improving the property values in one community and then keeping them low or even lowering them even more due to the kind of pollution and the activities of these companies in another area, and they have to investigate. So HUD has called in the Department of Justice to investigate the civil rights complaint. This is a novel complaint. It's never happened before. And we're really grateful, to the feds for taking it on and for doing this investigation. And we really hope that they will be able to do the thing that nobody else has, is to like really hold the city accountable for, and the state for these practices. We also filed another civil rights complaint to the US EPA, because before the city has to figure out what to do with, if they're gonna give this permit or not to General Iron, the state of Illinois had to give, the IEPA had to also give a permit to General Iron to start the process, and then the city, then it goes to the city for approvals. So there's also the US EPA has also took on this civil rights complaint and is doing an investigation.
Olga, we have a couple questions coming in related
Sure.
to what you're talking about, so I thought I'd jump in here.
That's fine.
One of the questions was, are Lincoln Park community organizations supporting the Southeast Chicago Community Organization in this struggle?
Absolutely, they are. Churches in Lincoln Park and Clean the North Branch is the name of the organization that had fought for many, many years. Laura Compton is one of the leaders in that organization who has been working with us, and they have taken up this fight as well, saying that, this is not a NIMBY situation. They're not trying to kick this out and then like they don't care where it goes. They're saying that if it's not good enough for them, it's also not going to be good enough for the people of the southeast side. So that's a great question. Thank you. We do have their support.
Thank you. We also had another question, and I'm not sure what they're referring to. Edward Gogol said, what is PM10?
Particulate matter, which is airborne, um, um, like debris, things that come off of, particulate matter can come off the exhaust of a car, it can come off piles of pet coke or piles of material that's being stored along the Calumet River. It's like dust, like dirt. But when that particulate matter, so particulate matter is just like a blanket statement, but like they could actually figure out what is in the particulate matter if they do testing. So it could have things like what we found in the air monitors along the Calumet River, manganese. Manganese is a particulate that is being stored on the banks of the Calumet River that when you inhale it is like a neurotoxicant. So there's also different sizes of particulate matter. We really rarely ever see air monitors that are collecting data. It's not required for them to collect data. It's not required for companies to monitor PM 2.5, which is, we know is like even more fine, that can really get lodged into the lungs and enter into the bloodstream a lot quicker. That's not even being tracked. Right now, PM10 is the size of the particulate matter that is being tracked.
I have another question here that came in earlier, and maybe if I can bring Dr. Murray back in the conversation for the Q&A session. So this question is that the environmental part of 2025 sounds like things folks have been saying since the late 1970s. What are the changes in decision-making processes that may increase the likelihood of accomplishing these goals? So this question was submitted by Frank Avalon. I wanted to share it and see if Dr. Murray wanted to chime in, and Chloe as well. And I'll repeat it.
And I just want to say hi to Frank, the longtime friend. Thank you, Frank, for your question.
I think that's an important question. And while I know we're not, we can't talk about everything in this little short webinar, but this goes to not only, as I mentioned, the state regulations, it also goes to national regulations. And so we have a regulatory process with the EPA that's frankly broken. Some things we just haven't changed. Some things are mistakes. So for example, look at lead in the water. And Chicago has one of the worst problems with lead in our drinking water. I know Flint gets the news, but we have a serious problem here. One of the problems here is that the federal regulations about that haven't been strong enough. So to answer his questions, it means we really have to change the regulatory, not only the process, but the standards. And there's been a presumption for the past 40 years that chemicals and companies are innocent until proven guilty. And so we have to understand that we're not talking about human beings when we talk about companies and chemicals. We're talking about entities, and we should not allow them to hurt us. So it does mean going back to the root causes of these problems. We spend a lot of time, which is very important, fighting that, like we're doing in this particular instance, fighting the permitting process and trying to argue within present regulations. But we have to understand that the present regulations do not protect human health.
Thank you. I think I wanted to see if Chloe also had some thoughts on this question. And Olga, if you wanted to take down your screen so we can see everybody at the same time.
Sure. I think in addition to what Dr. Murray said, some of the demands and commitments, especially around an environmental equity working group and advisory group, really are an attempt to start the conversations about where these decisions are being made earlier in the process. So, in a lot of cases, we see community engagement or a public meeting or something like that happening late in the permitting process or late in the engagement process when the plan is already there. Things are pretty much set, and it's kind of, just ceremonial in a way. So trying to push further and further towards the beginning of when decisions are being made and ideas are being proposed, and actually get that community input and you know, gut checks earlier and earlier on in the process is part of what we're working towards.
And we also had a question. Somebody raised their hand, but I missed their name. Was it Johnson, possibly, who wanted to ask a question? And well, in the meantime, if you raise your hand, can you raise your hand again so I can see if I can see you?
Yeah, that was Cheryl Johnson. I saw her. Is she
Yeah,
still
Cheryl,
on?
you wanted to unmute yourself to ask your question?
Yeah, well, I agree with everybody said, and thank you, Dr. Murray, for all what you do. I've been watching you for over 30-some years. But the problem is at the federal level, just as Dr. Murray said, you know, one of the most effective programs that we can get involved with is the Superfund program. But Chicago doesn't qualify for Superfund money because it's only, the selection criteria is only on one criteria, which is source of drinking water must be contaminated. Because we have a filtration system, this is why we don't have many of the industries in our community on the Superfund and the national priority list, because, you know, everybody, I hear a whole lot about cumulative impact. Until we change the federal standards on cumulative impact, because the federal government only look at one source industry. They don't do it from a collective, looking at it from a community standpoint. They say they don't have the technology to be able to do that, but we do have the technology to be able to look at all these industry as a single source, in opposed to put each industry single by single. So we need to be looking at and get this new administration to look at the reauthorization of the Superfund to include air quality, to include water contamination, to include poor housing standards. There's so many different criteria that can go into that will put it, because otherwise that Superfund money is just growing, but it's not being administered to any of the communities that really need it, such as Chicago needed this type of funding. So, you know, I work on a lot on the federal level policies, and it's really difficult, but you hear the people talking about cumulative impact, but until we change what the standards are from the federal level, you know, the state or the city is not going to abide by anything. They're not going to be creative and try to do something on their own.
Right. Thank you for your comment, Ms. Johnson. I had another question here that I wanted to just, you know, go ahead and ask. There was
Lily, I just want to say that really quick before you, Linda Ray Murray, when she started her presentation, was talking about Hazel Johnson. Cheryl is Hazel Johnson's daughter, who is running the organization now, and an amazing fighter. And she's a director of the People for Community Recovery, who has also filed the civil rights complaints. I just want folks to know, so like we're in the midst of some real heavy hitters here, man.
Wow, thank you so much, Ms. Johnson, for joining us. I really appreciate it. And you know, your wise thoughts about, you know, the federal issues that need to be dealt with. So the question I was going to ask was just another question that came up on the chat while we're here. And if other folks want to join in with questions, you know, please either raise your hand or add your question to the chat and I'll read it off. So the question here from Edward Gogo is kind of related, I believe, to Ms. Johnson's comment, is but also kind of big picture, and you know, why not just force the plant to clean itself up, change regulations to allow zero pollution. Sure, it would be expensive to the operators, but pollution shouldn't be allowed anywhere the plant is sited. So I think a lot of us here, you know, kind of probably echo some of these thoughts, but you know, I think to me it raises a question of like, you know, how do we organize to make this happen? So I wanted to throw that question out there to either answer Edward's question or talk about how we're organizing, or lessons learned from, you know, previous organizing struggles and how we can apply them now.
Yeah, I could, you know, Edward, that's a great question. And I think, like, you know, we have to recognize, like, you know, we're talking about a metal shredder. Like, this is a recycling operation. You know, people who are for, you know, saving the earth and, like, you know, having like less material in our landfills. You know, that we want to have metal recyclers, and we want to recycle those kind of materials so that they're not in landfills, but they have to be done in ways that are sustainable, that are restorative. And we know that in other parts of the country, like for instance in the South Bronx, you know, there is a metal shredder there that is completely enclosed, has rooftop gardens. They're like the premier, you know, company when it comes to recycling. And in the South Bronx, because South Bronx is in a community that is also a community of color, that has also impacted a lot by diesel emissions. So the thing is, Edward, that they could do it, you know, if it was required. So like, but the bar is so low in the city of Chicago, and the companies are constantly, you know, crying these crocodile tears that like, oh, we can't do these things because it's going to put us out of business. But it's not the case. We saw that with the Koch brothers, you know, when we fought the petroleum coke piles from that were on the Calumet River. They're like, we can't enclose all this, you know, like we've already spent $10 million on this water sprinkler system. Well, the rules changed and they were required to enclose their piles. They completely changed their whole mode of operation. They bring all the pet coke in now on trains. It goes directly to a hopper. Everything's enclosed. It goes into the barges and then it gets out of here. You know, so it could happen if we demanded, if our elected officials and the agencies in the city of Chicago are strengthening the policies, but we see that there is no political will to do that. That actually our elected official here in locally is actually trying to undermine the data that's in the data book that Chloe was talking about, undermine the city's own data, the map that we use, the cumulative impact map, and, you know, making a lot of assumptions that like we are exaggerating the situation. And that's a huge problem.
Wow. So I wanted to ask a couple other questions that were in the chat that are kind of related to this question about political will that Olga mentioned. So Jim Bloyd says, Chicago and CDPH have several officials such as Director of Racial Equity. Has this made any difference in the work of Olga Bautista and Chloe Guerin-Sands? Have they reached out to you? Has there been, you know, any commitment from folks who are dedicated to equity to these issues?
You wanna say?
Sure, I can start. So yeah, we are in close contact and work closely with folks that have come into these positions. So examples include, you know, the position Jim mentioned around racial equity at the health department, chief sustainability officer and chief equity officer in the mayor's office. You know, I personally believe these are all people that understand this and in their hearts, you know, want to move these policies forward and get us closer to this. They, I think, have come into these positions eyes wide open as to what the barriers are. And, you know, it's the fact of the matter is it's structural stuff that needs to change. It's a lot of this is beyond, you know, one person decision making, and in the majority of these cases, it's like one staff person with no other staff and very little funding to support their work. And so that is a lot of what we're seeing. You know, we're working closely, but you know, how much can one person do? So one of the things that we're trying to advocate a lot for is just being realistic about, you know, what do we really want to do? Let's try to, you know, scope out what the funds are that we need and put that out there to start getting more support for what we actually want to do.
You know, I think that Mr. Bloyd's question raises an important concept in public health. It's very rare in any country, including ours, that one person I don't care whether it's a mayor or a governor or a commissioner gets to make all the decisions. That's not what we're talking about. Clearly, there's a difference between saying race is a public health problem or saying we believe in equity and actually changing, as Chloe mentioned, the structural things that force the system to act in a racist way. And so that requires more than just good wishes. And what I expect, so certainly as a physician, if someone comes and sees me, I don't want any of my patients to have cancer, but if they do have cancer, I don't want to lie to them and say, oh, don't worry, you're okay. So what I expect from our health commissioner, what I expect from an equity officer is to say, this plant pollutes the air, pollutes the water, and harms people's health in Lincoln Park. And it does the same thing. Actually, it does worse on the southeast side because there's so much other poison already in there. To at least say that clearly so that if the governor and the mayor or whoever makes the final decision on relocating plants, it's the people are clear that our doctor, the Department of Public Health, has made it clear that this move will hurt people's health. That's what I expect, at least, if the health department doesn't have the authority and the power to actually stop it. In this case, they can deny the permit, which is what we're asking them to do. But so I think we have to make a distinction. Even if you can't fix a problem, you can at least be clear that the problem is there and not bow down to what the politicians want you to say. And to fail to do that is really to commit malpractice as a public health person.
Yeah, and I think what's really frustrating to me, another question I wanted to pose, what's really frustrating to me is a lot of these economic arguments about that, that these businesses are going to lose money. And, it's frustrating beyond belief to me to know that the Commissioner of Health is putting the wealth of a corporation over the health of my nephew and my niece who live blocks away from this proposed site. And I mean, I guess my question here is, what have you heard about this economic argument? Is this the lead on it? Some of the things that I keep hearing are just kind of obfuscations about like, well, we're not sure if we can deny the permit. We don't know if we have the authority. And but really, what's behind all of this, right? Is an economic imperative that this company has, and that many of our systems are kind of propped up for. So have you heard about this economic argument in the community?
Yes.
What is
Yeah,
your
no, definitely. We hear that, that we should be grateful because a company is going to come to this area that has been just decimated since the closing of all the steel mills, 40 years ago. And that we should be grateful for companies to come in here and provide jobs to our community. There is an active push by some of our elected officials to pit labor against environment, when in fact the campaign is being run by families who are blue collar families. My husband, for example, works for Norfolk Southern and is a union steward and is fighting every day for universal health care, for better protections for workers. And another leader that is very prominent in the fight to stop General Iron is Marcelina Pedraza, who is a friend of Lily and I, who is a union electrician, works at Ford, single mom, amazing activist, wickedly smart. And we refuse to buy into that narrative that you cannot have both, that you cannot have clean air, that we deserve to have clean air, and jobs that are not going to make us sick. There's also this narrative that's being pushed that we want to create river walks and make our community like, the 606, and that is completely untrue. Like we are we actually have a community led vision for a green economic industrial corridor, because we believe that industry can and should work responsibly. We have a plant here, the Method plant, that is a soap manufacturer that has the green rooftops, that has wind turbines, and that our planet actually depends on this. If we are going to survive climate change, we absolutely have to move away from the kind of industry that harms the planet, that harms the air, the land, and the water. And also the most important resource, right? Like the people who live along these industrial corridors, their lives matter and must be protected too. So we definitely, reject that notion that we need to choose between our health and our jobs.
Another couple of questions that have come down kind of while you're talking, Olga, is, where does the alderperson stand on this question? And then a question that came before was, is the Lightfoot administration hoping that the feds come in and sort this out because she's in too deep?
They both are in too deep. I think, I think the difference between our alderwoman and the mayor is that the mayor, she actually had put forward a vision, that we're able to hold her accountable to. But we need to see that from our alderwoman too. We need to see her, instead of shrugging her shoulders when a mom asks about the fact that her son had his leg amputated at the thigh level because of a rare bone cancer, and while he was in chemo, they met another family from the neighborhood with a little girl who had the exact same cancer that this little boy had. And it's it probably happened, it was probably because we live here. And there's no action behind that. And there's no vision for bringing, for one, to do health studies to get to the bottom of why are there so many people, so many children with these rare cancers? How is it possible that everybody, the doctors pretty much tell some of the folks that we have met, things like, well, we really don't see these kind of cancers in young people, so we can't even tell you what your life expectancy will be, or the chances of recovering, because it's really rare to see this in young people. And to constantly hear that people have these rare conditions, it should be a wake-up call to our alderwoman that she needs to double down on public health and on policies that will not just stop the pollution that's happening, but also we need policies that are restorative, that are going to repair harm that's been caused. We saw in Libby, Montana, after a huge crisis happened there, that the entire Libby, Montana got healthcare for life that followed them wherever they went, even if they left their community. We need that here. Every people in this community are just one cancer diagnosis away from losing everything that they have. And we know, because Chloe and we didn't get to go into so much detail about the data book that we helped create for our organizations. I work for the Alliance for the Great Lakes, and we partnered with researchers to really get to the bottom of some of these health impacts. Are we just making this up? Is this just anecdotal, or is there real data behind it? And it was incredible. We uncovered, we have data now that is foundational that we can start to, revisit again in 5 and 10 years. But we found that this neighborhood has higher instances of COPD, higher instances of heart disease, and it's also a community that is medically underserved. That's what we discovered. And this is a data book that the city could use when they're evaluating the industrial corridor down here for the Industrial Corridor Modernization Initiative, that instead of starting when where there was a crisis situation, they actually started on the North Branch of the Chicago River, down zone that area, and is making way for Lincoln Yards. So, the way that things play out, is a signal to us that they are continuing to prioritize wealthy white neighborhoods and industries, and not the Black and Brown communities and residents who live alongside these industrial corridors in Little Village, in Pilsen, the Southeast Side, in McKinley Park. It's not just here. It's happening all across the city, and it's putting a lot of people's lives in danger, and it has to stop, or they need to be voted out.
Yeah, not to mention, I always want to repeat, the $900 million that the city is giving to Lincoln Yards to develop their vision for for wealthy Chicago while relocating this scrapyard to the southeast side. If it wasn't frustrating enough, I have another question that came in. What kind of, this one maybe Chloe may want to chime in, what kind of accountability mechanisms exist or should exist for community health improvement plans such as Healthy Chicago 2025? If CDPH and Mayor Lightfoot say in their plans that they've committed to environmental justice, health equity, and anti-racism, and then violate those commitments, what routes of accountability are there or should there be?
That's a really good question, and I might ask Dr. Murray to jump in with some ideas as well. But I mean, this is making progress on these plans and kind of assessing where you are on them is part of the accreditation process for local public health systems. So we don't want our public health department to lose accreditation. That is not what I'm getting at. We want it to be accredited. That benefits all of us. But, I do think, again, maybe back to some kind of federal standards, like showing somehow that you are making progress on this. Yeah, that's a great question.
So I think again, we have to go to the structural components. Let me first say that accreditation in public health, as well as hospitals and other things, they look at, do you have basic things in place? They don't really test on how well you do. So the health department says all the right stuff. And that's what the accreditation is based on. What we're really talking about here is democracy. And so we need to be careful about that. And, democracy is a funny thing because when it's working right, it seems boring and we don't pay attention to it. So let me say that health, as we should know now from COVID-19, health departments in the United States have tremendous legal authority. Lillian, keep me honest here, I'm not a lawyer. Health departments have police authority. That doesn't mean they have anything to do with the police department. But what that means is, in the interest of everyone, if a restaurant is poisoning its customers, the health department goes in and shuts it down if they find a problem with it. And as we see with epidemics, the health department can say, bars have to close, et cetera. That's what we call police power. The problem we have here is that over time, the organization within the city that used to pay attention to this, the Board of Health, has now been, power has been stripped away from it because so much of what it did over many decades, it just sort of rubber stamped what the professionals in the health department, the commissioner of health, did. But this is an instance where this is a perfect example. Who should really be making this decision about whether to grant the permit or not? It should be a part of the government that's not paying attention to, at least in terms of health, not paying attention to the economic impact or anything. It should be a part of the government that's paying attention to the impact on the health of people. So in my opinion, we need to have a functional Board of Health with the proper authority that reflects the citizens of our city and has questions like this put to it. Should this plant be allowed to operate within the city limits in these conditions? And we've already agreed that that's not the case. They could build it differently and enclose everything. That's a different thing. But the way they're planning on running it will hurt people's health. So what that means is we have to be willing to rewrite the regulations, rewrite the processes by which we make these determinations and say, this is something that, just like we should be deciding what goes on in our school system with an elected school board, we should be deciding what's going on with the police department, with the process to have citizens control the police. I think with public health, we should have the citizens of this city, the people of this city, the residents of the city, deciding what's safe to operate within the city limits and what's not.
Sorry, unmute. So if that, didn't get you excited to take action, it sure got me excited to take action. I want to kind of segue to ask Wesley to how do we continue to put the pressure on? I think we've done a really great job. The community, as you heard from Olga, has done an amazing job over the last couple of years to keep the community safe. it's incredibly tiring to do this kind of work and to have to keep fighting for your life. And I want to thank Olga and all of the community, the hunger strikers, everybody that has done all the work. And the same with Dr. Murray and Chloe, just the commitment to environmental justice, to public health is apparent in the way that you talk about it. And I want to thank you so much, and being so inspiring to help us to think about how we continue to take actions with under the umbrella of public health, us as individuals, as a sector, the whole bit. So Wesley, did you want to help us take the next steps?
Yes, sure. Thank you so much. And if we were together in person, we do a big round of applause right now for our amazing panelists. And I'm applauding all of you and thanking you so much for your work and your wisdom and your thoughts and perspective on this issue. And I'm sure we get the same from our audience. And I want to transition a minute to close us out to an action tonight and then an action tomorrow. So certainly we want folks, we're really glad that so many of you joined us this evening to learn about this issue, but we also want to be a springboard for action. We've been taking action on this and we've engaged many others in that action as well. And we want to make sure that folks in public health are taking action. This is a political issue. It requires political pressure, political action to make progress. Right now, sorry. Let me just go to the slide here. So what we're going to do next is we're going to make signs and share those signs on social media. So we're going to ask that you do that on your own in your home, either during the program ideally or after the event, to make a sign that use the hashtag deny the permit and stop General Iron. And if you'd like to add this third one, NPHW, that's for National Public Health Week. And to share those in if you're on social media, share those in your tweet or on Facebook or Instagram or whatever platform you're using. So go ahead and make those signs. We're going to do one as a group similar to this one here. So we joined in a solidarity fast for one day. A number of organizers with Che Cook County and Health and Medicine Policy Research Group and partners as well. So similar here, we're going to make signs and take a screenshot. Let's see. I'm having trouble getting back to the Zoom myself.
So I wanted to again thank the panelists and see if we can if folks can start to work on your deny the permit. There it goes. You got it up, Wesley?
I got my sign right here. Sorry, I had a trouble getting back to the Zoom. And I don't know if Chloe, if you have a sign, if you're making one, or Lillian, are you making one?
No, I couldn't make one right now. I don't have a marker.
Okay. So, and I think Olga's still with us. Wonderful. And Chloe, are you planning on making a sign as well?
Sorry, I have no supplies in my house right now.
Do you want to be in the picture as well?
You can always hold up a fist. That works.
Yes.
Sure, I'll do that.
All right, Lily, are you doing a fist as well?
There you go.
Let me go ahead and make a screenshot. Great.
All right, great.
Great, thank you. We'll post that on social media. And again, if you're joining us at from your home as a participant, please do the same. And share that on social media. Tag also. Let me go back to my slides. Tag the mayor and tag the Chicago Department of Public Health if you're on social media. And if you're not on social media, you're not using Twitter or Facebook, please go ahead and share it with a friend. Maybe let them know what you care about, that you care about this issue. Pass your picture along and maybe urge them to take action. And so the other action that I'll share is that we're making calls tomorrow, calls and emails to Dr. Allison Arwady, the Commissioner of the Chicago Department of Public Health. those of you who registered and said that you were interested, either you gave us a yes or a maybe, we'll send you information for and a script to make those phone calls tomorrow. And if you didn't, I believe that there should be in the chat or the Q&A a link. Yeah, so in the Q&A, Jim Boyd has shared a virtual action form that you can click on and fill out and add your information. If you didn't give us a yes or maybe yesterday, or if you're not sure, go ahead and enter your information there. We'll send you the script this evening, and tomorrow we'll be making those calls, calling on them to deny the permit. So again, I want to thank everyone. I don't know, do any of our panelists or Lillian want to close us out with any closing words?
Want to thank everybody. Again, really powerful words, as Chloe said in the chat, very powerful words from Olga Bautista, Dr. Murray, and Chloe about, the urgency of this matter. This is our future, our children's future. I know Olga and Chloe have little ones like I do, and we're motivated by that. And Dr. Murray as well has also little ones. And so, if whether we do or we don't, this is our world and, our future. And we unfortunately, we can't let up the fight, right? This is what we're here for. This is what it's about. And let's make it about community, and let's keep on fighting until they deny the permit.
Thank you, everyone. Have a great evening.
Thanks.
Bye-bye.